send you back to work. Dr. Fisher.
Yes, good morning. Thank you, Dr. Allen. I'd like to start by saying Happy New Year to my DSU family. And I want to thank you for doing your part to keep the campus community safe during the fall semester. We masked up, physical distance, practiced good hand hygiene, and got tested twice a week. I'd like to extend a special thank you to Dr. Chris Mason, Enterprise Risk Management, and all the test site volunteers. Over 37,000 tests were administered from July through December. There were 168 positive cases, which is an overall rate of 0.5%, which is very good. Also, I'd like to thank Nurse Erin for taking the lead on contact tracing. Over 400 people were reached through contact tracing. And as Dr. Allen said, we really do need to do more. So this slide says, stay vigilant. So as the spring semester begins, it is extremely important that we continue to be vigilant and do our part to stop the spread of COVID-19 on campus. Recently in the news, there have been reports of new variants of the virus that spread more easily and quickly, but what they do know is that it does not appear to cause more severe illness or increased deaths. We also know that CDC infection control guidelines worked. We did it last semester, and our campus remained open. But we need to continue to adhere to them and be compliant with testing, because testing allows early identification and isolation of positives. So everyone must do their part and get tested. So it starts with pre-arrival. It is required that PCR COVID-19 tests be submitted 7 days prior to returning to campus. That is both for students and employees. And then students will be tested upon arrival to campus, and employees will continue to fall into that twice weekly testing cadence. Next slide, please. So what are our ongoing safety measures? I've already spoken about the mandatory testing 2 times per week, but what's new this semester is that compliance will be monitored. So don't be surprised if you're not following your testing cadence and you get an email or a phone call reminding you that you need to test, because we will be monitoring compliance. There needs to be daily completion of the COVID self-assessment screening app to gain entrance to campus. And we show that along with our ID at the front gate. Chief Downs is part of the panel, and he will explain that in more detail. Face masks are required on campus. Physical distancing, at least 6 feet, but I say more is better. Frequent cleaning of high-touch areas and shared surfaces. You will see plexiglass barriers. We need to use our personal protective equipment. And you'll see hand sanitizer stations on campus. We will continue to do WebEx and team meetings. And remember, prevention is key. So as the number of COVID-19 cases continue to increase, the best way to prevent illness is to avoid being exposed to this virus. And we all know how we do that, but it's worth repeating. Mask wearing, hand hygiene, physical distancing, and avoiding crowds and gatherings are critical to slowing the spread of this virus. It is also important to know the symptoms and monitor for symptoms of COVID-19, but it's also important to realize that COVID-19 symptoms are very similar to flu and other respiratory and GI illnesses that are common this time of year. So please do not ignore or explain your symptoms away. Get tested for COVID-19, reach out to your healthcare providers, and remember the symptoms are fever or chills, cough, shortness of breath, difficulty breathing, fatigue, muscle or body aches, headaches, loss of taste or smell, which tends to be more common than was initially thought to be, sore throat, congestion or runny nose, nausea, vomiting, diarrhea. Again, very similar to most common illnesses, but do not ignore them and explain them away. Next slide, please. It is very important that you stay home when you are sick and also isolate yourself from others in your home. Employees should not report to campus when they are sick. Students should not attend classes in person or go other places on campus when they are sick. If you are having symptoms of COVID-19, self-isolate and call the Student Health Center. The number is listed and is also in our directory. If you are on campus or your healthcare provider at home, you can notify either one of us or both of us. You will be placed in quarantine until you have a negative COVID-19 test. Monitor for symptoms and take your temperature. Again, stay home except to get medical care. Avoid public transportation, ride sharing, or taxis. Do not share dishes, drinking glasses, cups, eating utensils, towels, or bedding with other people in your home. And again, very important, separate yourself from other people. Next slide, please. I want to talk about travel, and just as a reminder, university travel is still suspended, except for the athletic department. It is also recommended that you limit your personal travel, both in the US and internationally. And as far as the campus goes, if you travel outside of the country, you will have a mandatory 14-day quarantine period. For state-to-state travel, quarantine will be contingent upon the conditions of that state and also according to state regulations. Next slide, please. If you are exposed to COVID-19, and close contact is defined by the CDC as being within 6 feet of an infected person for a total of 15 minutes or more. And that changed in the middle, I would say around late October, early November. It used to be for 15 minutes at one time, but now it is a cumulative time of 15 minutes or more in the presence of an infected person, or you have direct contact with an infected person and have shared eating utensils or drinking utensils, or were exposed to the respiratory droplets. That is all defined as a close contact. And according to the CDC, anyone who has been in close contact with someone that has COVID-19 needs to be quarantined. And the exception to that is anyone who has tested positive for COVID-19 within the past 3 months. Next slide. So it is important to review isolation and quarantine so that we're all familiar with it. Isolation and quarantine help protect the public by preventing exposure to people who have or may have a contagious disease. To make it more personal, this is how we will protect our campus community. Individuals infected with the virus will be isolated for a minimum of 10 days, and their close contacts are quarantined and told to monitor for symptoms for 14 days. I want to stress that confidentiality is always maintained. So if you test positive, your close contacts nor your supervisor will be informed. Employees who test positive for COVID-19 will not be permitted to return to campus for 14 days after the 10-day isolation period, but you can work remotely. Contact the Student Health Center for clearance, even if you are medically cleared by your primary care provider. You will not be retested for 3 months as per CDC guidelines, and you must notify your supervisor if you're going to be out of work and for the length of time that you're out of work. Next slide, please. As many of you are aware, CDC has changed their quarantine guidelines. The new guidelines state that individuals can be released from quarantine as early as 7 days with a negative COVID test and 10 days without a test. Individuals are instructed to continue to monitor for symptoms, report them if they should become symptomatic, avoid crowds, and continue to wear masks and social distance anytime they are around other people even in their own homes. The CDC continues to endorse 14-day quarantine. So what does this mean for campus? The current campus protocol is going to be that employees will be quarantined for a minimum of 10 days, tested and evaluated by the Student Health Center before returning to work. Again, employees must notify their supervisor that they will be out of work. If you are placed in quarantine or isolation by the public health department, you must notify and submit a copy of the letter that you receive from them to health services. Students must notify their instructors if they will be missing in-person classes. Faculty can reach out to the Student Health Center for verification of absence, but it is the student's responsibility to make you aware that they are going to be out of class. Students will continue to be quarantined for 14 days and retested at 10 days. The health team will continue to monitor for trends, evaluate information as it becomes available, and implement changes as indicated. Next slide, please. Okay, next I want to talk a little bit about the COVID-19 vaccine. According to the CDC, vaccines are the one tool that we have to fight the COVID-19 pandemic. Vaccines work with your body's natural defenses, so your body is ready to fight virus if you are exposed to it. It is important to continue other preventative measures to stop the spread of this virus. Next slide, please. Studies have shown that the COVID-19 vaccines are safe and effective at keeping you from getting COVID-19 and may keep you from getting seriously ill if you should get the virus. I would like to share with you that a few members of my team and I myself received the vaccine, and I have not had any symptoms with my first dose of the vaccine. In fact, I wasn't even sure that they gave me a vaccine because I didn't even feel the injection. I want to make a correction. When I did the infection control training, I mentioned that the FDA had approved the COVID-19 vaccine, but actually they have authorized the vaccine for emergency use because of the current state of emergency. And with vaccines, and Dr. Green is going to go into this in full detail, there is a difference between approval and emergency authorization use. So I did want to share that with you because it is always my goal to bring you timely and accurate information. So I just wanted to bring this to your attention. I'm going to now turn this over to Dr. Green, and he is going to give us a COVID-19 medical update. Thank you. Dr. Green, you're on mute.
Oh, okay. Thank you, Dr. Fisher, and thank you for that presentation and for all of your leadership and guidance. And I don't know how many of you are aware, but Delaware State University, from the very beginning, from the onset, when we first learned about the pandemic, has been on the front line. I mean, in terms of following CDC guidance, following science and doing things. So the leadership from the board, from Dr. Allen, all the way down to Lucretia, everyone has been enormously participating in a plan to be able to balance this delicate, balance between allowing students to be able to stay on campus, knowing that without an education, there's consequences, and knowing that if we don't respect this coronavirus with all of the safety measures that Michelle just spoke about, that there'll be consequences. So it's a very difficult, delicate balance, but by following the guidelines that Dr. Fisher just laid out is what allows us to be able to do that and walk that path and keep the mission of the university as well as keep everyone safe. I wanted to just briefly just talk a little bit about the, and I'll do this in reverse order, the various variants to the virus, the COVID, that have come on the scene since around December or so. And you've probably noticed that even from the beginning of the pandemic, there were different variants, like in China versus Europe, versus other parts of the globe. But what we know to be true is that there are always going to be alterations in the virus. But one of the things that we can do to limit the opportunity that the virus has to continue going through making various mutations is not allow it to have as many hosts to participate in making these changes and replicating itself, because it's during the replication of itself, when it's reproducing itself, those errors that occur in that process in its DNA replicating itself and making RNA are where those mutations tend to occur. And most of them that occur are not even significant, but occasionally, as we've learned recently, there's some that can occur that can make the virus more infectious. And as Dr. Fisher mentioned, although we know now that it's not any more dangerous in terms of causing severe infection or death, but there appears to be on that spike protein there an ability for it to have a little more affinity for the cells. So in the nasal passages and where we contract the virus, it tends to be able to hold on a little longer and thus make itself easier to open itself up into our system, basically by entering. The longer it hangs around, the more likely it is to infect. So that's one of the main reasons why we want to keep our social distancing and masks, because if we can deny this virus opportunity to spread, then it has less likely probability of mutating. With regard to the vaccine, now that there's mainly three main players, the Pfizer vaccine and the Moderna, and now AstraZeneca is coming on board. And all three of those pharmaceutical companies have used this technique called messenger RNA. And what I would like to do is just kind of debunk some of what I think is information that's out there that is not helping us with the idea of vaccination. For one, I think it was probably a misnomer to use the word, warp speed, because I think that's given a connotation that things are being done so instantly that it makes it hard to trust it. But when you look at the timing, when you actually dig down into the data, the timing, this process of messenger RNA has been going on for about 4 or 5 years prior to now. In other viruses, it was being studied to be used as a vaccine. So that was one of the things that we didn't have to start the process, new. The other big point is that China shared a lot of the sequencing of the viral DNA to other countries, including the United States. So we had a big head start on knowing what the sequences were in the virus to be able to replicate and make the messenger RNA. So that's one thing. Plus, there was huge amounts of funding that was used that we don't see in other vaccines. So there was a lot of money. There was a lot of collaboration between the private sector, governmental sectors. So all of these things and a number of other things that culminated into allowing the time frame to be shorter. And the other thing that was sort of it's ironic, but that helped it to be quicker, is the fact that during the phase of the trials, the virus was so prevalent that you could give the vaccine trials and then have them exposed to people who were infected because it was so prevalent in the community. So you could get data back a lot quicker than something that wasn't as infectious, as contagious. So for those reasons, all of these things culminated into being able to come up with an emergency use thing. And to mention, as Dr. Fisher mentioned, this emergency use is just that there's compelling evidence that there's enough advantage not to wait through the lengthy process of an FDA approval, which requires more people in the study. Like for right now, we don't have children. Children are not a part of this emergency use authorization because it hasn't gone through that whole thing. After the FDA completes it, it'll go through other strenuous, trials to make sure that everyone's included. So most of the safety data that we have are on adults, 16 and over, is why it's primarily just emergency use for the adult population. So timing is one of the things. The other, I think, thing we should debunk is this idea of it being genetic. There's nothing in the science or literature that supports that the messenger RNA vaccine enters into the nucleolus of the cell. So there's no intermingling of this vaccine with our DNA because it stays in the cytoplasm of the cell. It does not, and it's just bringing information like a blueprint. So that vaccine, what it does is it's injected. It then goes to the cell, crosses the membrane, and then it provides information for the cell to produce the protein that looks like the spike, that's similar to the spike, and it puts that little protein on the surface of the cell. Then our immune system comes along and recognizes this antigen on the surface of the cell as foreign, and then we produce antibodies against it. Other vaccines have used particles of of viruses and so forth to try to mimic it. But so there's no live virus at all. So you cannot get the infection from this messenger RNA vaccine because there are no viral particles. In fact, our cells are producing the antigen, the protein that looks like the spike, the S protein on the COVID vaccine, for which the body is going to attack. If it comes into our body, then it'll recognize that. So the other question is, if I've had natural immunity, should I still get the vaccine? Well, the evidence that we have now is that you probably only have a 3 to 4 month period of natural immunity after having it. So it would still be recommended to consider the vaccine because you don't have a sustained period. And although we don't know the exact period of time after getting the vaccine either, how long you have, but the data does support you get a much higher level of antibodies after the vaccine than you do with the natural immunity. So it still would be recommended even if you've been previously exposed. So with that, I wanted to just be able to answer any questions related to what we've discussed. Or
I believe we'll probably take questions at the end of the forum, Dr. Green.
Okay.
So,
Okay.
next we will hear from Chief Downs.
Oh, okay.
Thank you.
Mm-hmm.
Good morning, and thank you, Dr. Fisher. As you all know, last semester we had a pass to get on campus. It was downloaded through Campus Shield. Again, this semester we're going to ask you to download that application, and each time you come on campus, we'll ask you to show that pass. Once you download the application, there's a medical question survey that you'll take. It's just a few questions, just to see if you have a temperature or if you have any symptoms. If your answers are no, then you'll get a green pass. If you already have some symptoms, you'll get a red pass, and we'll contact you or someone from the healthcare center will talk to you about that, so we can have some discussion that will allow you to get on campus at a later time. If you accidentally hit a wrong button, then we'll contact you or you can contact us, and we can reset that so you'll be able to get the correct pass to get on campus. However, this semester we're going to be paying much more attention to this to keep our campus safe. So please be very aware of downloading that pass. And the pass is good for 24 hours. So each 24-hour time period, you need to download that pass. And each time you come on campus, we'll ask you to produce the pass. So please have that ready when you come on campus. If you don't have it ready, we'll just politely ask you to pull on the side, download the application, and then show us the pass. If you have any questions at that time, just ask the officer there. He can help you get the pass or contact our police department, and we can assist you in downloading your application. Also, there are times that we have vendors on campus and we have visitors on campus. We'll ask all the staff and faculty members to please notify us if there are vendors coming on campus that have to be on campus, if there are absolutely visitors that need to be on campus during this time, because we'll also ask them to download this application. And there's going to be a link in the COVID-19 site on our webpage that will allow them to go directly to that pass, download the pass, answer questions so they can get on campus. But we're also asking you to let us know of any vendors or visitors that actually need to be on campus during this time. Once again, we just don't want outside personnel coming on the campus, so we can keep the campus community safe. For employees that are going into the administration building, you've probably seen this temperature detector at the door at the admin building. We're going to set that up again. We were testing it during the last semester. We're going to set that up. We have some signage there. We're just asking everyone to walk through there. It will take your temperature as you're coming in. We have one set up at the admin building. We have one set up in the library. And just to walk through there, it'll be fine. You just walk through. It monitors temperatures as go through. If someone does have a temperature, we'll get an alert on that, and we'll contact you and just talk to you about it. Most likely someone from Dr. Fisher's office will contact you. We'll have some discussion with you about that and act accordingly regarding that. This semester, once again, just please have your pass ready as you come through the front gate. If you have any questions or any problems at all, just ask the officer at the front gate or contact our police department. Please pay attention to the temperature gauges in the administration building and the library, and just please give us a call if you have any questions at all. We'll be paying strict attention to this once again, so we can keep this campus community safe during the semester. Thanks a lot, Dr. Fisher.
Okay, thank you, Dr. Fisher, Dr. Green, and Chief Downs for those very thorough reports. I hope our university community understands how hard you all are working. But the key fact, as I talk to the students, is our ability to hold each other accountable. So it really is up to us under the guidance of these great leaders. So, Brother McMillan, you want to open it up for Q&A?
The first question that I will provide is, in phase 1B, educators and teachers are scheduled to be inoculated. Are there any plans to inoculate DSU faculty and staff on campus?
Yeah, Dr. Fisher, you want to take that and I can add on?
Yes, we are in the process of planning to have vaccine clinics on campus. I have completed all the necessary paperwork with the state, and it is just a matter of them doing some compliance checks and then letting us know if we are approved to administer the vaccines on campus.
Next question.
Can you explain the CDC guidelines related to the retesting in a 3-month window and what that actually means?
Sure, Dr. Fisher, Dr. Green. Dr. Green, you want to take that?
Sure. Now, are you speaking about whether or not someone has developed antibodies in repeat testing, or are you talking about? I'm not certain. I just want to make sure what we're asking.
Dr. Green, I can clarify. I believe they're asking when I said the CDC just recommends that we do not retest positive people for 3 months because they will continue to shed the virus.
Right.
For that period of time.
Okay, sure. Yeah. And also that 3-month period of time is also the period of time that we think that someone who's exposed will develop antibody. So it is not important to recheck when there's going to be resistant particles. If you have non-viable particles, they can continue to test positive. So the data is not really that helpful. If you retest someone who tested positive and you repeat it 4 weeks later, then you're more likely than not are going to get continued positive tests, but not because they're infectious, but because there are non-viable particles that remain in the nasal pharynx.
I guess the next question would be, is DSU faculty and staff required to get the vaccine?
No, I can answer that question. There's obviously, we want you to get the vaccine. I know there have been lots of media reports relative to the vaccine and its safety, et cetera. And this is particularly important in communities of color. So just to make sure that we understand the elephant in the room. I can tell you that we strongly, strongly encourage it. I don't know if you've heard this before, but Dr. Fauci was on talking about this very thing with some civil rights groups and noted that the woman who developed the vaccine was a Black woman. And they are highly sensitive, and I can tell you just because of my other roles, highly sensitive to making sure that folks feel the safety and efficacy of the vaccinations, but highly encourage it. All we can do with you all is highly encourage it. So no, we can't make you take the vaccination. What I can say is the testing is not something that's optional. So we will still have that prescription. But if you're reading lots of materials out there, make sure that they are based in science. I'm sure Dr. Green and Dr. Fisher can tell you their general view as medical professionals, but I can assure you that it behooves all of us, particularly folks who are from communities of color, to get vaccinated. Dr. Green, Dr. Fisher, you want to add anything?
I would just agree with you entirely on that. And any of the safety concerns have pretty much been eliminated in terms of them not causing diverse effects. There's not been any data to support any significant side effects.
And Dr. Allen, again, I agree with you as well. And like I shared during my presentation, I did receive the vaccine. And many of you know that have heard me speak before, I believe in prevention. So any of the preventive measures that we have available to us, I always encourage people to take advantage of them. I also say if you have any questions or concerns as to whether you're a candidate for the vaccine, please speak with your primary care provider before going to any local places to receive the vaccine.
Thank you. Brother McMillan?
For faculty who are first returning to campus this semester, even if we test today, we will likely not be able to produce negative test results 7 days before we are supposed to be back in class. Will any leeway be given under those circumstances?
Dr. Fish, you want to start and I'll finish up?
Sure. We are having testing all this week. When I say all this week, I'm sorry, actually starting on Thursday, we are having testing events on campus from 8:30 to 4:30. And if you test on Thursday, you will have your results back on Saturday. So please come out.
Couldn't say it any better than that, Dr. Fisher.
There are 2 or 3 different vaccines that are available with regard to age, sex, and/or secondary conditions. Is one vaccine more beneficial or recommended over another?
I've not seen any significant data to support one or the other. I mean, in that the storage capacity is the major difference, in that everyone has the capacity to store the Pfizer vaccine because of the requirements of storage. But in terms of the efficacy, it's really very, very, very little sunlight, that goes between the two in terms of their efficacy.
Thank you, Dr.
Will there be any consequences for those seen not following CDC or DSU COVID-19 protocol on campus or off?
Yeah, there have always been consequences associated with that, both on the staff and faculty side and the student side. Look, the idea here is to keep you all safe and for us to hold each other accountable. And if there are special requirements or qualifications that some students or staff need to make some accommodations we need to make, we've been open to that. But I can tell you that you're not, by wearing a mask, for instance, you're not only protecting yourself, you're protecting your colleagues and your students. By testing regularly, we are creating a bubble, and there have been very universities of our size that have been able to do that in the fashion that we've been able to do it. And it helps just to maintain the academic continuity. And quite frankly, particularly as the vaccinations go out, it'll help us open up sooner and safer if we do this right. So I just can't stress enough how important it is for everyone to follow those guidelines and to hold each other accountable.
What are the testing requirements for adjuncts who only come on campus once a week?
Dr. Fisher, you want to take that one?
Yes, anyone reporting to campus is required to get tested twice a week. If you don't want to come to campus to get tested because you're only on campus once a week, you can get tested in your community and submit your test results to COVID test results 2020 at desu.edu.
And we'll make sure we're distributing our spring reopening plan by the end of the week here. We'll make sure that information is in there as well.
Are there circumstances set up for someone who does not have a phone to be able to download the app?
Actually, I don't know that might be a question for you, Chief Information Officer.
Well, I'm assuming that if someone doesn't have an app, doesn't have a phone, we would have a paper copy for them to fill out at the desk. Is that correct, Chief? Would that be the process?
Yeah, actually, last semester, if you didn't download it on your phone, we were still using the link that goes to Ms. Spinner, I believe, and they were able to provide you a clearance through that.
Any other questions?
There are reports in the news that suggest people with extreme allergies should not take the COVID vaccine at this time. Is that your recommendation as well?
Well, I think we'd have to examine what those severe allergies are, because there are some people who have severe allergies where the observation period can just be longer after they receive the vaccine, and then some can be, medicated depending on, but the risk benefit ratio has to be considered. So I think in that case, I think it would have a real good conversation with their primary care provider and come up with a strategy. But unless they're known to have a severe anaphylactic reaction, meaning that their blood pressure dropped, they developed respiratory distress, and they became almost unstable, there's usually some ways around those allergic reactions, and they can still be eligible for receiving the vaccine.
The only thing that I would add to that is please get the vaccine in a controlled environment and not at a routine vaccine clinic if you know that you have severe allergies.
And that would be it as far as questions, Dr. Allen.
Okay, thank you, Brother McMillan. Thank you, Dr. Green. Thank you, Chief Downs. Thank you, Dr. Fisher. I hope the university community feels the seriousness with which these leaders and others have taken on this task. Again, it really is up to us to maintain our level of service, the academic continuity for our students, and most importantly, the safety for one another. I have thought a lot about what has happened over this last year. And I know that while we talk about the particulars relative to the protocols and those kinds of things, there's also a very significant human element here. People have lost lives. People have been decimated by the disease. People have lost their jobs. And we see that as real with respect to how our students, staff, and faculty must be feeling at home. It's also not lost on me that there is some mental stress that comes with being confined to your house or other spaces with folks, with your family and friends, but also away from folks who may be your family and friends that you haven't seen now in almost a year. So it's not lost on us, both the quantitative and the qualitative part of this. But with respect to how we get through this, we have to do the little things every day in the right way to make sure that we are safe and that we can get past this ultimately. And while it's not all that fair a comparison, I can say when you think about COVID-19 as one pandemic and then what we have faced with respect to insurrection, racial unrest, and the like, as quite frankly another pandemic, there's a longer way for us to go, but we can get there together. It's very important that we remember we can get there together. So trusting one another, making sure that we're doing all the things to keep our community safe, and really being an example of the ideals that a place like Delaware State University believes for ourselves, for our students, for our community, and for each other is paramount to be an example to the nation. So I thank you for the opportunity. I thank all of my colleagues for their incredible expertise, and I am looking forward to a tremendous spring 2021. Take care, everybody.